Like everyone else has been saying, we're here to talk about the perspective of this residency from the resident side of things. We'll briefly talk about just each of our rotations and just what the experience is like on each of those. And then I think the bulk of this will be sort of answering questions that you guys gave to us. And I hope that by answering those, we can sort of give a broad overview of what life is like in St. Louis and what life is like for us as residents here. But overall, I can't plug this place enough. It's such an incredible training opportunity. It's such a great place to be. We all really love each other as residents and as a residency. So very excited to tell you more about this program. So like I said, we'll talk about some rotations. So laryngology. Sorry, one second.
Ethan was on laryngology pretty recently.
Yeah.
Great, be happy to talk about that. So I'm Ethan, I'm one of the third-year residents. Laryngology, as Dr. Bradley mentioned, is certainly one of our strengths, particularly as a junior resident. There's a lot of cases to be involved in early on, and now being in the third year, definitely appreciate having some experience with the airway while I'm holding that emergent airway pager. Another strength is we have some excellent speech pathologists who have a ton of knowledge, but also really like to teach. That's really great rotation.
Great.
And then I can briefly talk about general since I'm one of the chiefs on that service right now. I do want to emphasize that while we have specifically the general attendings that we have listed here, that also encompasses other services such as laryngology and rhinology. And so that's a pretty outstanding training experience for us, both all the way from our intern year through our chief year. We get a ton of exposure to laryngology, rhinology, is in addition to some head and neck with thyroids, parotids. What's unique about our general experience is that we also have a lot of exposure to silent endoscopy here, which is just endoscopic treatment of various salivary gland disorders. That's not so common. There's not that many centers that offer that. So it's a kind of a unique jewel that we have here. And here's a bunch of us. I believe this is Christmas at the Budweiser Brewery.
I think you're right. Yeah. I think Ricardo.
Hey everyone, I'm Ricardo. I'm one of the T32 residents. Just finished up my T32 years and now starting back on. Sorry, let me just turn my volume down. Going over the feedback. Starting back on clinical. But anyway, I think rhinology. One of the newer things in the last year or so is that the PGY2s now have a dedicated rhinology rotation, which is great. Starting off early, learning the kind of the endoscopic skills early on. Another great thing about our program is that we have a wonderful simulation lab. And actually just this week, the seniors are finishing up a endoscopic sinus, an advanced endoscopic sinus course with fresh cadavers, which is great. We do have a course annually that all of the residents can attend as well. And that's done in collaboration with SLU. So those are really great courses as well. We get a ton of experience with inflammatory sinus cases, but also, as you can see on the slide, a bunch of skull-based cases. And I think one of the nice things is that you get to learn the nuances of multidisciplinary care with some of these, in collaboration with neurosurgery with some of these skull-based cases. So all around great rotation.
All right, who's on peds now? Teresa, you want to talk about our children's experience a little bit?
Sure. So if you have seen the WashU Instagram stories in the last week, you have seen a little bit about the peds experience. But we have a big peds department and it's getting bigger. Dr. Bluer will be joining us in October of this year, I believe. And we really benefit from having a freestanding children's hospital. We see the full range of pediatric ENT. And the different attendings, to some extent, have a little bit of specialization for each one. So I was in a tympanomastoidectomy with Dr. Hirose this week. Last week, Dr. Malter had a laryngotracheal reconstruction, which was awesome. I got to help take the rib graft. We definitely do a lot of tubes and tonsils. Like I did 5 tonsils today, I think. But we also have lots of interesting laryngology, head and neck, rhinology, and we have attendings from the adult side also come and treat pediatric patients sometimes as well. Like for complex tumors, we have some of our head and neck attendings come help. But we also get, your usual lots of foreign bodies, lots of airway surgery, lots of DLBs, a few supraglottoplasties. So it's really a wide variety. And something that helps a lot is our nurse practitioner, Karen Shanker, is the reason that I get to operate so much instead of being on the floor, because she helps us a lot with things on the floor during the day. And then we also have an intern on the team who spends a lot of time in our interdisciplinary clinics. So we have our regular clinics with our attendings, and we also have a vent clinic for our trach patients. We have a cleft and craniofacial clinic that's joined with plastics and dentistry and a bunch of other services. We have vascular anomalies clinic. So we have a lot of work with a lot of other departments, which is awesome. And then our PGY4 gets their pick of the best cases, the most exciting pediatric cases, and is also a great mentor to me. So it's a great team.
Yeah, thanks, Teresa. I just wanted to add one thing, which is the awesome thing about Children's, and Dr. Buckman sort of mentioned this at the beginning, is that it's part of the same complex as Barnes here. So, you don't have people who are out at a different site during their pediatrics rotation. It's all kind of, within the same area. So nobody's kind of off on their own during that time, which is nice.
All right, here's another picture. This is obviously pre-COVID, but get together after our annual in-service exam. I've got whole crew there. Okay, and then otology. Catherine, you're on otology. Do you want to let us know a little more about that experience?
Yeah, so this is a really great rotation. As you can see, we have a pretty deep bench of otologists. We have 5 very clinically busy attendings, and that translates into a lot of great cases for the residents. I think one of the great things about our program is that we get pretty early operative experience in otology as a junior. So as a PGY2, we do 10 to 11 weeks of dedicated otology, and they really encourage us to go to the OR and work on our drilling skills. And just to give you a sense of that, my average week is like 2 to 3 days in the OR, and I'm usually the only other resident with the attending there. So I'm doing like key parts of the case. And just to give you another kind of idea of what early operative experience means to us, I'm about 3/4 of the way done with my otology rotation, and I'm only a few mastoids away from completing all of my key indicator mastoid cases to graduate residency as a PGY2, which I think is pretty neat. And so, you get really comfortable drilling, you get comfortable with the anatomy, and it's a really great experience. We also have a state-of-the-art temporal bone lab that Dr. Buckman showed earlier, and it's super nice. And we have a ton of available T-bones. So like in addition to instructor-led temporal bone course that's part of our curriculum, we're encouraged to independently go and grab a T-bone and just start drilling and kind of work on our skills. And the faculty are super supportive of this. Like I'm meeting with Dr. Wick later this week on a facial recess that I did last week. So it's a pretty great opportunity. And then we also, this is really fun too, we have this like lateral skull-based course with the neurosurgery residents that's hosted by Stryker. They provide the instruments, like free food, and you get an opportunity to do some like advanced neuro-otologic approaches. Like I went last year and I was an intern, and I was doing like retrosigmoid, like middle cranial fossa on these cadavers. So it's like a really great opportunity. And I think otology is a big strength of our program, and it's a really great experience.
Nice.
Probably the biggest strength.
No bias at all.
Yeah, no bias. We haven't talked about head and neck yet.
That's why I had to throw it in there now.
Yeah. All right. On class.
I'm actually on facial plastics now, so I'll
right.
take this unless somebody else has anything to add. But it's a really fantastic experience. Facial plastics, we see the full gamut from, really severe traumas due to the fact that we're a level 1 trauma center, all the way to, a nice cosmetic practice that's really spearheaded by Dr. Spataro. We even have a resident Botox clinic where we learn how to inject Botox and fillers. And that's, something that is free and available. So you can, just talk to Dr. Spataro if there's something that you want to try out on, a patient. So that's really been fantastic, but there's a huge variety of stuff, lots of reconstruction, and especially lots of Mohs reconstruction. And then, like I said, there's even all the way down to, a nice cosmetic practice in clinic as well, where you can get experience with, peels and other sorts of facial procedures in the office.
Oh, we got a crew here at the Arch. Nice.
The best looking class.
Oh,
out there.
Rude.
Where's
Agree.
Oh, the biases are showing.
You're missing someone there.
David's not in that picture.
The photo's better without the last one. Whoever that last person is, the photo's better without.
This is clearly pre-COVID.
Yes.
I mean, they're distanced from everyone else, but. All right, head and neck.
Dr. Perham. All right.
Yeah, Dr. Perham, it's our time to shine. So head and neck, very high volume, excellent experience here. There's so many opportunities to get in early. I think you've heard from a couple of the twos already talking about how much they've gotten to do as a second year, and it's only August. Certainly during my first and second year, had a lot of opportunities to operate. Someone had also asked about sleep surgery and exposure to that, and Dr. Jackson, one of our head and neck surgeons, does a fair amount of sleep surgery and does the hypoglossal nerve stimulator, so we thought we'd mention that now as well. Dr. Jackson also leads a free flap cadaver course for the residents here in St. Louis, which is an excellent opportunity. We also thought it was worth mentioning that we engage with the community through our head and neck screening clinic, so we go to 2 different areas in St. Louis to try and reach out to more people that might not have the opportunity or transportation to come see us. And then, as the children's team mentioned, we also have a physician's assistant on the head and neck service, which is a tremendous resource. As Teresa mentioned, it's a big part of why we're able to spend more time in the operating room.
Ethan, how many neck dissections did you do as a PGY2?
Many. So I'm almost reached my key indicator numbers as well. It's just an awesome experience.
It's an absurd operative experience.
And there was a question here about free flap cases. Honestly, the numbers, Sean, to answer your question, can range anywhere from sort of, I would say an average week is 5, low week is 3, and a crazy week could be as high as 9 or 10. I think these numbers, when you're a med student, somewhat hard to put into context, but I think what that basically summarizes is that's a lot. And the cool part about that is you get to do a ton of different free flaps. We're not doing like where I did residency, which I won't name for conflict of interest. Now that I'm fully WashU, we did mostly ALTs and forearms, and we didn't do much else. Here we're doing scapulas, we're doing fibulas, we're doing a ton of other stuff. And as a resident, you'll get exposure to all that. And the other thing is we have 1 fellow. So there's a ton of opportunities for senior residents to really function as kind of that sweet spot between a resident and a fellow. So we would love and encourage chiefs and even fours to be helping us with micro. So it represents a really cool opportunity of our program.
Yeah, and that's not even mentioning all the robotic cases and thyroids, giant thyroids, big parotid cases. I mean, there's a ton of head and neck in addition to all that flap surgery.
But it's also important to note that we're not spending every night until 3 a.m. operating on free flaps, because our surgeons are very efficient. They have we have 2 surgeons in most cases, 1 person doing resection, 1 person doing recon, 2 teaming it, and they're great. So usually you're out at a reasonable hour.
Yeah, you operate like mad and go home, and it's fantastic.
Yeah, absolutely. I think we try to find efficient ways that people realize that head and neck doesn't need to be, you know, a lifestyle that you can't be normal. And I think that the residents see that, and that's probably why we have a decent number of residents going to head and neck. And there was another question here. I don't know if one of the residents wants to handle it. I can also take it.
Yeah, so we do a great amount of thyroid here. GenSurge does do some thyroids as well, but it seems like the volume is high enough that certainly we're not hurting for any sort of experience with thyroids. I think by the time I was like early 3rd year, I'd already done, you know, 11 as primary surgeon. So, you know, there's plenty to go around for everyone for sure. I don't know if you wanted to add.
Yeah, I don't know whether there's been additions, but general surgery only has 1 dedicated endocrine surgeon at this time. So there's plenty left to go around. And also if it's complex, that person will just send them to us anyway, so.
I think we have the advantage of doing the really complex ones and the easy ones. You'll see both, you'll get chances to do both. My very first thyroid here was 18 by 24 centimeter goiter, which was just a chip shot, right? So, you know, I think it's really cool. You'll get to see everything. And Dr. Zavaios is our division director. He's arguably approaching or is already the busiest thyroid surgeon in all of St. Louis, I would argue. So, great opportunity.
Somebody has to throw in here that we occasionally go to clinic too. It's not just the operating room, but.
Very true, Dr. Molter, thank you.
We do have a good clinic.
The beauty of laryngology is in clinic.
Yes.
All right, let's see. And speaking of head and neck, here's one of our esteemed head and neck attendings in his customary weekend rounding attire. Probably a little sweatier than we can see. All right, and then consult service, also key. Who's been doing work on that? Catherine?
Hello. Yes, this is a great rotation. So it's the PGY1 and the PGY5, and it's a wide variety of pathology because it's just whatever comes in the ER, whatever inpatient consults you see, and they're great intern cases. Tons of neck pus, tons of trachs. I did a lot of that as an intern. I actually think I logged like 22 trachs like as an intern. So it's like a crazy operative service, I think, for the intern. Another unique thing about the consult service is that we have an OMFS, a really busy OMFS practice here, but we don't have OMFS residents. And so those cases are for the intern. And it's a really great operative experience, especially so early on. And the nice thing about those attendings are that they're pretty independent in terms of they don't need you to do the case or do the orders, but you're welcome to do it. So it's like strictly an educational opportunity. And I think as an intern, I did like 3 mandible fractures where I was the only resident in the room with the attending and like drilling screws in, plating. And so you do some pretty advanced stuff even as an intern. I think it's a great experience all around.
Yeah, and it's not just unique to Kathy's experience. I'm in her class as well. And I would say the most trachs I did in one day was 5. And I was also in a lot of the OMFS cases, learning to sew in the mouth is just hard and fun to do without one of the head and neck attendings breathing down your throat.
There's definitely a theme here of a lot overall and a lot of that early. Oh man, this is great. This is, I think, from the holiday.
This picture has been so widely shared.
Oh.
It's an epic picture.
So good. And then who's at the VA right now?
I think Jake is.
Yeah, I can speak to this. I'm the 3rd year at the VA. So the VA, I think it's really important for a residency program to have a VA experience. I mean, it's a very unique patient population, but also typically VAs, you have a lot of autonomy, whether it's in clinic or the operating room. So we have one dedicated head and neck surgeon. That's our chief, Dr. Sean Massa. He did fellowship in head and neck here. And with head and neck, we actually do free flaps at the VA, which is probably the minority of a lot of VAs. And, you know, with free flaps, I mean, if you're doing free flaps at the VA, that means you have enough kind of experience and enough comfort and enough support staff to kind of manage head and neck volume like that and head and neck complexity. But also, it's not just head and neck there, you know. We do otology there every Wednesday. Typically, as a third year on Wednesdays, you do a lot of otology cases with Dr. McJunkin, one of our otologists at Barnes, who comes over. And then going on facial plastics, we have 3 rotating facial plastic surgeons that go there. So on Fridays, you mostly work with the fellow. And honestly, I think at the VA, you get so much open septorhinoplasty experience that, you know, you normally won't really get at other places. And it's just you and the fellow typically. So I think, you know, not only are you letting these veterans breathe better, but I also think they have some of the most attractive noses that are out there. And then on top of that, you know, you see the whole gamut. You know, you see Mohs recon defects. You do local flaps there as well. And then you see all these patients in clinic. And basically, it's full continuity of care where essentially when you're on there for 10 weeks or 11 weeks or 12 weeks or so, you're seeing all these patients back that you've operated on, see them in clinic, and basically develop kind of strong relationships with.
Nice.
And then night float.
Hey, Zach, are you there? I know you were recently, you just came off night float a little bit ago.
Yeah, hey, can you see me?
Well, we
Yeah.
see slides.
I see you now. Great.
Sorry, I'm multitasking. I
We
just
can
had a
hear
new
you.
baby. This is a great program for people who have families. It's a very good culture, and it's a wonderful place to live. But in terms of night float, I think it's a challenging rotation, but it's certainly a time when you spread your wings and you kind of run the hospital when you're there at night, while still having, you know, you always have someone on call with you as backup. So it's kind of like graduated responsibility to kind of spread your wings a little bit. But I think the best part of night float is really the service you do for all your fellow residents. Everyone who's not on night float can really attest to the quality of life bump from not having a Q4 call. So all your night call is really concentrated into this night float experience where, you know, you grow as a resident, but also you really help out everyone else in the hospital by by covering everything that comes up overnight.
Yeah, night float makes life much better.
Huge for quality of life for everyone who is not on night float.
Yeah.
And Zach, now you're prepared to be night float for the rest of your life.
Yeah, well now I'm on 24-hour call with this guy, but it does. I mean, it interrupts your rhythm so much to be on a Q3, Q4 call system where you're just every fourth night kind of getting swamped. Whereas when you concentrate it on night float, you just switch over to nights. You know, you work your shift. You're kind of, you know, you're nocturnal for that period, and then you go back to being normal. You know, when you're on other rotations, you have time in the evenings to read and be a normal person because you're not always just in recovery mode.
I can also
I think it's important.
I was just going to say, you know, you're not automatically thrown into night float. You know, as an intern, you get when you're on the consultation service, you get a lot of shadowing experience with the second year or the third year that's on call and during the day. And so you're learning these basic procedural skills, scoping patients and evaluating, triaging, and also communicating are kind of the skills that you'll develop early on as an intern before you're kind of thrown into this night float situation. But once you get into the rhythm, it is kind of great because you're the first line. You're the person that everybody calls. You know, there's a bunch of procedures that you can do as well in the emergency department. So it's procedural. It's not like you're just, you know, the secretary picking up the phone. So there are some things that you can do as well. But I think it's a great, I'll second what Zach said, just great growing experience overall.
And I'd like to mention that it's so basically because our main adult hospital and our children's hospital are on the same campus, one night float person's able to cover both. So you're not having separate call pools where at least 2 separate dedicated residents are kind of driving around everywhere to cover hospitals that are remote from each other. So I think that's a big plus in terms of quality of life, especially for those that aren't on night float.
All right, and then this is just an everyday occurrence, I'm pretty sure.
Otolaryngology.
Yeah. Well, we had a ENT one earlier, so.
Very true.
All right, then Jake, you want to tell us a little more about T32?
Yeah, so I just finished my 2 dedicated years of T32 research. Kind of the numbers speak for itself. I think if you want to do basic science research, just like a few of our residents have done, or translational research like Ricardo is doing in that picture, or I just went the clinical outcomes research pathway under the guidance of Dr. Piccirillo. I think either way you have, there's a lot of mentorship that's actually pretty structured during your 2 years in order to finish projects, submit manuscripts, get them published, go to conferences, and kind of network and develop working relationships for your future academic career. In addition, we have monthly academic career development conferences within WashU. And on top of that, there's a lot of support for getting core grant funding or applying for any of the academy grants. So I think on average, we probably have at least 1 resident that gets a core grant a year. So there's definitely infrastructure for that, as well as the support, and also the track record kind of speaks for itself.
Great. And then, so I think we probably spent a lot of time talking about those rotations, more than certainly we planned. I think a lot of that is just, we get really excited about each of these rotations. Like, we really are passionate about our education here and really believe that this is one of the best, if not the best, training experiences in the country. Just a few other things we kind of wanted to talk about on top of that is that, Dr. Buckman is our chairman who you met earlier. He still spends a lot of time with the residents despite all of his leadership roles and how busy he is, and every month meets with us for at least an hour and just kind of talks to us as a program chair to resident. He's definitely very involved in all of our training experiences and also our lives. And then this is more pre-COVID, but on Buckman's dime, would have a monthly resident social where he'd pay for us to all kind of get together and have a lot of fun together. Dr. Buckman's featuring pretty prominently into this other resident highlights section here. And then a summer intern welcoming party and barbecue at his house. And then just other events. We have an annual golfing tournament that goes back a long, long time. We can see other luminaries that have graduated from this program is listed on the trophy as having won the annual golfing tournament at certain years. And then a white elephant holiday party. That's a fun tradition. I think we have a picture of that coming up here. Here it is with Jake with the greatest prize of all, a portrait of one of our most esteemed graduates, Colin Chen.
You didn't mention Dr. Paniello's talent show over here.
Oh, yeah.
Yeah, if you want to talk about that for like a quick second, that's pretty awesome.
Dr. Paniello just loves talent.
Yeah, Phil hosted at his house, and you can, play his piano or sing. And last time he played Piano Man and had a mouth harp going. I mean, it was fantastic. He's great. So.
All right, so this is actually where we plan to spend most of the night, kind of going through these questions and using that to talk about our lives in St. Louis and lives as residents, because despite all the operating and clinic and education, we do have a lot of fun here and spend a lot of time together. So we're hoping that these questions would kind of hit on that, as well as any other specific questions from our residency experience and training. Okay, so what are the residents' views on the strength of surgical clinical training experience? Catherine, you got pretty excited earlier about your otology mastoid experience, so I think this is a good one for you.
Okay. Yeah, so I can speak for, from the junior perspective, but world class, I think that we have a culture here where we get people get juniors and interns into the OR and really encourage them to not just, sit there and observe, but to really, operate. And like I said, I was looking at my case logs the other day, and I logged like 22 trachs as an intern. And now at the beginning of my PGY2 year, I think I just walked Jordan, who's one of our new interns now, through a trach with Dr. Perham, actually. And so it's really great that as like an early PGY2, I feel comfortable doing that. And it's not just on head and neck, like you get great operative experience on every rotation. And it's just part of the culture here. As a senior, they're well trained, and so they feel comfortable kind of letting the junior like spread their wings and do their thing in the operating room. So I think it's a great experience here.
Yeah, and just to harp on that, breadth and depth was mentioned as one of the keys on choosing a strong residency program. And to me, that's breadth is total number of cases we do. I hope we've made that clear. And then the depth, that's depth. The breadth would be a total number of attendings that you have. Seeing it from many different perspectives, from many different training programs is important. And to have 7 different pediatric otologists and then 3 different laryngologists, it really adds a lot. So it's not just you're getting trained the same way to do a trach 22 times. It's you get a lot of perspective.
And then I guess for the next question, learning and advancing surgical autonomy, this might be actually a good one for a senior resident, just as we've gotten the junior resident perspective on this, on how much is going on early. But I don't know if Avi or Steph Chen, if you guys want to talk a little bit about how this progresses and what it's like being a senior resident in this intense operative experience.
Sure, I can chime in. So I'm currently at the VA, and I think that pretty much epitomizes what it means to have surgical autonomy. So at the VA as a 5, we kind of have the opportunity to really run the operating room, and I think that's why it's so important to have a VA experience. So on the otology side, you walk the juniors through cochlear implant from start to finish. Dr. Massa lets us really get to work on neck dissections and sinus surgery. And so I think it's very much a graduated responsibility, and it kind of culminates when you're a 5 at the VA. You really are running the room for fairly complex cases. And I don't know of a lot of places that let you do that. So I think it's important to look for that VA experience and just make sure that you get it as a chief, because it really does help you kind of transition to an attending.
Mm-hmm.
Yeah, I think even at Barnes, the attendings are great about having you become more autonomous as appropriate. Like you always feel safe, but they also step back and let you struggle a little bit and then give you very good pointers. I've been really impressed by how great all the attendings are in terms of teaching and guiding you and sort of letting you spread your wings, but in a safe way as well, even at the main Barnes campus. It's really great.
Mm-hmm. I think that kind of covers this last question as well here, so we can go from there. As an intern, how much time do you spend in the OR versus clinic performing floor work? Steph, Yusuf, you were just the head and neck intern. Any input on this? Or Catherine, you were an intern not so long ago, and you were just talking about your bajillion trachs, so I think that kind of hits that point.
Yeah, I think that's one of the unique parts of this program, is that even as an intern, we encourage you to go to the OR and not just trachs, but do a lot of cool skin cases. And I think one of the best parts of being such a high volume center is that sometimes as an intern or a junior, you're doing advanced parts of a case because out of necessity, like this is kind of an extreme example, but I think it's a cool one. When I was an intern, there were like 3 separate times that I got pulled to raise a free flap with one of the attendings. I think I did one with Dr. Perham once, one with Dr. Rich, but I mean, that's a pretty neat experience as an intern. I don't think a lot of people can say that about their first year in residency, and I certainly can. And it's not a unique experience. David can probably chime in and say that he had a similar one. But I would say overall, the OR clinic, like the floor work, it's a pretty balanced experience. It's not like we don't go to clinic and don't get that experience. In terms of floor work, like we said, we have a PA who kind of offloads a lot of that. I think anywhere you go, you're going to be doing floor work as an intern. It's like a rite of passage. But I think we do a pretty good job at making the situation balanced. So, yeah.
Yeah, and with respect to clinic and floor work, the head and neck service is a lot of OR and a lot of floor work. At the children's rotation, it's predominantly clinic. And those are both important aspects of intern year. That's really actually where you develop your clinical reasoning and judgment. A lot of what I do as a 2-on consult now, gain the skills in Pete's clinic in terms of gathering a history, which is one of the most essential things that we'll do as the primary consult person.
So to give a general summary, you have 2 months intern year in peds, which is mostly clinic. You have 2 months or 3 months as a consult resident, which is mostly OR and a little bit of floor. And then head and neck is like 80% OR, 20% clinic, and floor mixed in.
Yeah. And then for this next question, I'll take this for the PGY5s. If you're hypothetically entering general practice right now, I am entering general practice. I guess not this minute, in about 10 or 11 months, but even right now, even this minute, the answer is a resounding yes, with whether it's soft tissue, head and neck cases, otology, rhinology, laryngology. I feel very, very comfortable with the scope of a general ENT plus some into each subspecialty. But we've been talking a lot about training, so let's go on to some more fun stuff. Oh, yeah, here's me. That's not my kid. I don't know if that makes it better or worse, but it's fun nonetheless. All right, different clinical training sites. I think we've talked about that a little bit already, touching on the VA, Children's, and Barnes. We also already have numerous satellite hospitals where we go and do more outpatient type cases. Autonomy still remains high throughout. And then just for the sake of time, I think we can kind of go through some of this stuff a little quicker. Miranda, do you want to kind of just take us through these last ones here, and then we'll...
Yeah. I do think we kind of touched on a lot of these here. Laryngology, you have both a dedicated rotation as a PGY2, and then it's also enfolded into general time as well as you move up into a senior. Again, sleep medicine is often addressed by Dr. Jackson, doing some of the sleep surgery on the head and neck side of things, but does also, emerge into other rotations as well. During one of my rotations as a PGY2, I also went and spent some time in the sleep lab to understand a little bit about how, they actually do the sleep studies and how to read those, because that is part of what you want to learn. Facial trauma, we have a huge amount here. I just did, 3 different mandible and ZMC fracture cases today. We have more later on this week. You get a really good experience with that sort of thing. For the structure of the call system, we kind of touched on that a little bit, night float being 6 nights a week. One of the PGY2s takes a 24-hour on Saturday, and then there is always a backup senior, one of the 4s or 5s, who is the backup for the night float person, and that's just shared around, so that's pretty doable. It's pretty nice.
Works out pretty well. I mean, despite how crazy busy we are, how high volume we are, we still I think have a pretty good life. Then qualities we value in our co-residents. Carter, what do you think?
I think, I think it goes without saying, somebody has good work ethic, somebody who can listen, somebody who's reliable. But I think, even more important is somebody who's personable, somebody that you enjoy interacting with, and that is going to be able to interact well with others. I think those are, can't be understated either.
Do we fit your criteria, Ricardo?
Absolutely, you do.
All right, cool.
My criteria is somebody who likes brunch.
So important. I think what we want to get that is that, obviously value things that anyone would want in a coworker, but we all get along very well. We're all very close, and certainly that shows in the hospital. It makes it very easy to work in the hospital when you're with your friends. And then we also spend a lot of time out together outside of the hospital, being friends there as well.
For sure.
Qualities that we appreciate in our applicants, kind of same. We're looking for those same traits, mostly people that are hardworking, team players, things like that. No surprises there. All right, so do residents get along together outside? I was really waiting for just this kind of specific question because I felt like this is our opportunity to really talk about our lives outside the hospital, which I feel like we haven't gotten a chance to talk about quite as much. But this is something that, I think we should all chime in. Like, what kind of stuff do we do together outside of work? We talked about our department-sponsored socials already, but then also kind of the smaller stuff in between that.
Yeah, there's a lot to do here, actually, in St. Louis. I think uh, Steph Chen and I just went wake surfing on the Mississippi River the other weekend, so that was fun and different. So there's like a lot of random things you can do. Lots of great restaurants. There's a fantastic food scene here. There's lots of free stuff to do, particularly in Forest Park. You know, the art museum is fantastic. The zoo is also free and also wonderful. And there's always just, you know, festivals and stuff when it's not a pandemic in Forest Park throughout the summer. So there's like tons to do.
Yeah, the zoo is rated #1 by whoever rates zoos throughout the country. So also, yeah, this past weekend, went hiking with a few of my co-residents. Avi was there, as well as Ben Wally. So yeah, if you like outdoorsy stuff, there's stuff to do there. If you like to brunch, there's stuff to do there too. So I think it has all the things that a city can offer.
Who's the blues fan here? Is Ricardo a blues fan?
I mean, kind
Yeah, I love the blues.
Also cards.
Yeah, there we go. I was just going to mention that pro sports here, you know, I'm new to St. Louis. I'm not, you know, I'm from Ohio actually. And so I think like the first week that we moved in here, the Blues won the Stanley Cup. And so got to be a part of those celebrations. Got to know that Gloria is like the theme song of the entire city. And so it's like really fun. People go to baseball games here all the time, Blues games as well. But it's a great city for sports, you know, for those that enjoy that.
And we just got an MLS team as well. So St. Louis City.
Whoa.
And XFL. But don't mention the Rams.
There was the Battle Hawks for a time.
We love the Battle Hawks.
No, the Rock bought the XFL. It's back.
Oh, never mind. Okay, so the Rock.
Thank goodness, Dwayne the Rock Johnson. That man.
Yeah, I mean, like we said, there's a ton of free stuff also outdoors, which is super fun. So Forest Park was designed by the same person who did Central Park in New York City, and it's bigger. It's the biggest urban park in the country, and it is chock full of stuff to do. There's like a little like pond river area where you can get paddle boats. There's free golf. Well, the driving range is free. I think you have to pay a little bit to go on the golf course, but it's certainly not much. There's nothing that's that much in St. Louis, which is nice. There's tennis courts. I know Avi and Ben have been playing a lot recently. There's just so much stuff to do outdoors, and then also indoors. There's lots of fun like places to go and bars and things like that, but also an outstanding food scene. I was really nervous about that because I'm fat and moved from New York, and I just wanted to keep and growing. And I was like, I guess I'm just not going to be able to keep doing that. And boy, was I wrong. There's a ton of delicious stuff to eat here.
Yeah, and I think oh, sorry, go ahead.
I'm from New York City, and so I was very nervous about moving here because I've only ever been on like the coasts, and there is a nightlife here. I mean, not during COVID times really, but you know, there's still outdoor activities and stuff, and we still all hang out outdoors. And then yes to the restaurants, very good. And there's also concerts and things like that. I went to a concert with Sebastian right before COVID hit, and
I was there too.
Yes, Catherine was there too, but it was Sebastian's thing. Like he was into it.
Wow.
Anyway, so anything you could want in a city is here.
Yeah. And I think that that's basically, you know, people adjust really well here. Like I said, I've been here for a while. I'm not originally from St. Louis, but I fell in love with both WashU and with the city of St. Louis, even though it's totally different than where I grew up. And you'll find that there are a lot of people here who choose to keep staying. There's, you know, attendings who did their residency here, you know, went away for fellowship and decided to come back. That's, you know, not uncommon, which is really nice. I think a lot of people find a really fantastic niche and a really great living situation here. One of the other things I wanted to mention really fast is right near, you know, if you want to live close to the hospital, which I certainly did, this is a fantastic place to be. The Central West End is really nice. You can walk to work. I basically run across the street and I get into, you know, the Sky Bridges super fast, so I can get to work really easily. If you want to live further out, you can. The commute's super easy. I think Dr. Molter mentioned down in the chat there. It really is a a fantastic place to be able to live. Cost of living's cheap too. All that good food, it's not going to break your bank, which is nice.
Very true. The real estate market's also quite favorable. I'm in the 7-year program, and you're looking at a homeowner, which I don't think I would have said or thought I would say in residency. Her too, and she's in the 5-year track. So those are all things to consider, because you're not just getting training. You're living 5 years, 7 years of your actual life, and can't pull off the delayed gratification too long. You got to enjoy every second.
Good life advice.
Yeah.
We are like, I can't stress enough how happy I was that everyone here is honestly very good friends. Like, I feel like I'm notorious for this. Elizabeth Wick, who was one of our chief residents, was also notorious for this, but like, we'll be in the workroom, it's like 7:30 and it's like, 6 o'clock at night or whatever. And all of our work's done. And I just like linger for like 30 minutes talking to people. And I'm like, why am I here? I have no work. I should just go home. But like, that happens like all the time. Like, we just like hanging out and like spending time with each other. And like, there are multiple like nights a week where I'm just like lingering around the workroom, like talking to people, and I have to like tear myself to like go home.
Sometimes it's nice to keep the night float resident company.
Yeah, guilty of doing that also, Catherine.
Cool. Anything else anyone wants to talk about here, or any other questions for life in St. Louis? I know it's late, so I don't want to keep you guys too long here.
Yeah, sorry we ran a little bit over.
Yeah, so we can kind of burn through what's left. Oh, and another big social. Pre-COVID, David always has the best shirts.
Yes, he does.
The best. Why didn't you wear one of the Hawaiian shirts for this?
And my entire closet is on display right now. I got nothing else.
He's got 8 of those banana shirts.
That's it.
Yeah.
And here's some kayaking around as well. Noma's thrilled. All right. So I think research funding, we kind of already talked about with the T32 a little bit. Yes, and it's easy and supported, definitely by the faculty. Pediatric research opportunities, more specifically at children's. Teresa, do you want to give that one pretty quick, and then we'll try to wrap things up here after that?
Sure. So we have several faculty members who are doing research. Dr. Hirose has a lab and works on congenital CMV and meningitis in animal models at the Central Institute of the Deaf. And Dr. Liu is our big clinical researcher. If she's still around, maybe she could talk about some of her projects. And then I know Dr. Leonard has a project going on with joint with anesthesia for tonsillectomy patients. Dr. Dunske Menezes just got a grant recently for ENT manifestations of primary ciliary dyskinesia. So lots of different people doing lots of different research in the Children's Hospital.
And large pediatric cochlear implant grant that was just awarded as well. So work to be done in there.
Nice.
Not forget about that.
Yeah, there's a lot of research being done on the pediatric hearing loss front, especially. As Dr. Beckman mentioned, there's just a brand new grant that just got funded. My area of research has been in quality of life in children and try to predict, what would be the best treatment for kids who are like maybe not the greatest of hearing aid candidates or cochlear implant candidates, but there is no end to research opportunities at WashU. And I think it really depends on what your passion is and what you're interested in, and you can probably find an attending who can help you with that. I'll just leave it at that.
Well, one other pediatric study is Lisa Davidson's work in pediatric cochlear implants and childhood development. So she has some fantastic work there.
Great. And then unlimited time and resources or upcoming changes. Ethan, do you want to talk about these ones?
Sure. Someone had submitted this unlimited resources and time question, which was kind of a fun one to kick around. We fortunately have a lot of support, but when we started to think about it, as a resident who's still doing a lot of consults, having the disposable and distal chip flexible laryngoscopes is something we talked about would be really nice. We've started doing that at the Children's Hospital as well as with the oncology patients. Especially there, where we really want to minimize any chance of bringing an infection into that room. So we've seen that those are nice and functioning well. And if we were going to pick something to use those resources on, we thought that would be neat. In terms of the upcoming changes, we've talked about new staff coming on, as well as increasing involvement at some of the other satellite centers around St. Louis. Raj, did you have anything else?
I mean, we're just constantly growing. The trajectory is always up. We're always getting new faculty, expanding to new hospitals. We're starting to move to another site kind of up north called Christian Northeast. That's coming a new resident site. So that's the big change, just growth, all constant growth, and it's great.
And Raj is part of that growth because he will be an attending at Christian Hospital.
Right. And some advice to give to an M4 in your position. I'm too far removed from this, maybe someone a little younger.
Yeah, I guess we can answer that one. So some solicited and unsolicited advice. Some solicited advice, keep your mentors, keep in touch with them even after you've submitted your application and they've written a letter for you. They're really valuable resources. Like when I was a medical student, I met with my mentors frequently to talk about programs, like tips going into interviews, and they helped me with my rank list. And also, you know, if you're interested in getting an interview at a specific program or matching there, ENT is a small community, and so your mentors end up being really helpful in that regard. Some unsolicited advice, try to relax and chill out. Easier said than done, but I think I speak for everyone when I say that I wasted way too many hours refreshing Otomatch every time an interview invite went out, to refreshing my email, like locked in my room, just like super anxious. And honestly, you know, it doesn't make a difference. Like what happens is gonna happen, and try to focus your efforts on things that you can control and things that not on things that you can't. Like M4 year is one of like the best years. It's like graduating college or graduating high school, and like, you know, this is the last year you're going to be with, you know, your medical school friends in that city that you spent 4 years in. And so, you know, try to spend time doing things you love with people you love, and try not to stress out about the process so much.
Yeah, and to dovetail on that, there is no such thing as the perfect applicant, or to say you're better than someone else or you're worse than someone else. There's really more about match at this kind of thing. So there is such thing as a perfect match. Just kind of be honest with yourself, what you want out of a career, what you want out of a program, and there will be a mutual feeling on the other side. I think for my personal statement, I remember writing about growing up at the dinner table, essentially. And the places that I did interview at enjoyed that. The ones I didn't probably didn't. So I ended up at the place that I enjoyed, and that would be my recommendation to you. Just put whatever it is you are on paper.
That's beautiful, David. All right, so thanks, guys. I know this was really long. This is also a post-in-service exam celebration. Thanks for joining. I'm sorry that we went long. Again, we just get very excited about this program. I think we all universally really love it here. Obviously, I mean, this is what I've said in person in previous years. I really believe it. The training here, especially the operative experience, is just bananas. There's no other way to describe it. It's absolutely absurd how much we get to do in the OR, both from a volume and autonomy standpoint, while still getting a great experience in clinic and in patient management and consults. And then on top of that, we all get along really well. I hope our various pictures here kind of shown that as well. I mean, I just could not ask for a better residency training program than this one.
Completely agree. It's been a fantastic experience so far.